Hi guys! Welcome to my vlog. This is Angelica Gito from N3B, your katok for today.
Ate Indian, kamusta ka na?
Ito, medyo okay na.
Nabalitaan ko kasi na matake yung pots mo.
Oo nga eh.
Ano ba yung pots?
Teka lang, meron akong video dito eh.
Meron ka din. Tingnan.
Syndrome. Felt like I was having a heart attack. Nobody really understood it, and I didn't get diagnosed till I was 17. I was constantly in and out of the ER rooms. You can't predict when you're ill when you have POTS syndrome. It can come out of nowhere. I had just fallen because I got really faint. My knees gave out, and I actually completely dislocated my right knee. I started getting tremors, so I couldn't make straight lines anymore. I couldn't do makeup on other people. A good day with POTS syndrome looks like I take my medication and it works. A bad day with POTS syndrome is just as soon as you wake up, you can feel your heart palpitating, and it feels like your entire nervous system is just on a sugar high and you can't figure out why. What inspired me to share my story online is because I wanted to be able to not feel as alone. Whether you have conditions that are like POTS syndrome, to make the best out of what hand that you're dealt. I think it's important to raise awareness around POTS because since they are invisible, the more our voices become heard, the more people will be able to understand.
Ano? Maliwanag pa sa video?
Medyo. Kaya lang gusto ko pa magkaroon ng deep learnings about POTS ay mas maklarify pa sa akin.
So, para mas maliwanagan ka, explain ko sa iyo kung ano ba talaga yung POTS, yung signs and symptoms, and yung mga possible treatments ng sakit na yun. What is POTS? POTS is an abnormal increase in heart rate that occurs when standing. Ito daw ay ang pagbabago ng tibok ng puso natin o pagbilis ng tibok ng puso natin tuwing nagbabago tayo ng posisyon o tumatayo. What does POTS stands for? P. Postural, which means related to the position of your body. O. Orthostatic, related to standing upright. T. Tachycardia, which means increased heart rate. And S. For syndrome, a group of symptoms. Did you know that POTS or postural orthostatic tachycardia syndrome is a form of dysautonomia, which is a disorder of the autonomic nervous system and also a branch of nervous system that regulates functions we don't consciously control, such as heart rate, blood pressure, sweating, and body temperature. According to Dysautonomia International, POTS is estimated to affect 1 out of 100 teenagers and including adult patients with a total of 1 million to 3 million Americans. Moreover, it is most frequently seen in young women, often less than 35 years of age, with a female-to-male ratio of 5 out of 1. Lastly, it is common after stress such as sepsis, pregnancy, fever, surgery, or trauma. So, here are the common signs and symptoms of postural orthostatic tachycardia syndrome. Severe or long-lasting fatigue, lightheadedness with prolonged sitting or standing that can lead to fainting, brain fog, which includes trouble focusing, remembering, or paying attention, forceful heartbeats or heart palpitations, nausea and vomiting, headaches, excessive sweating, shakiness, intolerance of exercise or a prolonged worsening of general symptoms after increased activity, a pale face and purple discoloration of the hands and feet if the limbs are lower than the level of the heart. POTS symptoms typically get worse in warm environments such as hot bath or shower, a hot room, or on a hot day. Also in situations involving a lot of standing such as waiting for a bus or when shopping. It also gets worse if the salt and fluid intake have not been adequate such as after skipping a meal. Furthermore, POTS symptoms may also get worse when you get a common cold or an infection. In severe cases, POTS symptoms can prevent a person from being upright for more than a couple of minutes. This can greatly affect all aspects of personal, school, work, and social life. How is POTS diagnosed? Postural orthostatic tachycardia syndrome is difficult to diagnose due to its many symptoms. The following are the tests that needs to be done if the patient has POTS. Tilt table test. It is the gold standard of POTS diagnosis. It helps you measure your heart rate and blood pressure as you change posture and position. Besides the tilt table test, other testing may be done for POTS. Blood and urine test for causes of POTS and conditions that mimic POTS. QSART, a test that measures the autonomic nerves that control sweating. Autonomic breathing test to measure how your blood rate and pressure respond during exercise. TST or tuberculin skin test, skin nerve biopsy, echocardiogram or ECG, blood volume with hemodynamic studies. How is POTS treated? It is treated by a medication like salt tablets, fludrocortisone, pyridostigmine, midodrine, and a beta blocker may be prescribed to help control POTS. Additionally, thigh-high medical compression stockings may also prescribe. These stockings help push the blood up from the legs to reduce POTS symptoms. Blood pressure monitor to check blood pressure and pulse. Lastly, although the heart is healthy in most POTS patients, you may be evaluated to enter a cardiac rehab program. This exercise template uses a cardiac rehab model to recondition and help improve health and control POTS. Some of the best data for treating POTS comes from cardiac rehab. So, ngayon alam mo na kung ano yung POTS syndrome
Oo.
at aware ka na sa mga signs and symptoms nun.
Siyempre, dahil ako natutunan din sa video.
Good to know. So, ayun na nga mga katoks. Thank you so much for watching this vlog. I hope you learned something from me. Don't forget to like, share, and click the bell button below. Thank you!
Talks po, talks.
Huwag ka na mag-talks.